Today is the penultimate day of the 2026 Commonwealth Games in Glasgow, the biggest medal day of the entire competition, with 44 gold medals on offer. The headline is a mile race between the man who broke the world record 2 weeks ago in London and a 20-year-old Australian who thinks he can beat him in Scotland. The Iran bombing pause has now held for approximately 8 days, with no confirmed strikes from either side. Oil down from $100 to $88, the bilateral nuclear narrative quietly but documentedly shifted from zero enrichment toward less urgent. And 18 confirmed U.S. dead in a 5-month conflict whose opening stated objectives have changed substantially from what they were on February 28th. And Uganda declared its Ebola outbreak under control on July 16th, with its last patient discharged, while in the Democratic Republic of Congo, the same virus has killed 967 people across 5 provinces, and healthcare workers at the hospitals treating patients are on strike because they haven't been paid. Let's take all 3. Start with Glasgow, because on the last day of July, I want to start today with something that's not a war. The 2026 Commonwealth Games began in Glasgow on July 23rd and run through August 2nd. 74 nations and territories are competing. Approximately 3,000 athletes. 215 events across 11 sports. Athletics and para-athletics, gymnastics, bowls, boxing, track cycling, netball, judo, swimming, weightlifting, and 3x3 basketball, a deliberately scaled-back version of what Commonwealth Games have historically been, by design and by necessity. The backstory of these games deserves to be told, because it's genuinely remarkable. In 2023, the Commonwealth Games Federation awarded the 2026 Games to Victoria, Australia. In 2023, after a review of costs and logistics, Victoria withdrew, at massive financial and reputational cost, triggering a crisis for the entire Commonwealth Games movement. The CGA scrambled for an alternative host. Glasgow, which hosted the 2014 Commonwealth Games, emerged as the last viable option. In August 2024, Scotland's government agreed to host, with funding coming from $200 million in compensation from the Victorian government for their withdrawal, with the explicit condition that no significant public funds from Scotland or the UK would be required. The result is these games, leaner, using existing infrastructure across venues including Scotstoun Stadium and the Tollcross International Swimming Centre, with a condensed sport program that still represents 74 nations competing in meaningful competition over 11 days. Today is day 9, the penultimate day, and it is the biggest day by medal count in the entire Games. 44 gold medals. The athletics program, which ends today, on the last day of track and field, is awarding 19 Commonwealth champions. The showdown that has been building throughout the week is in the mile. Josh Kerr is a Scottish middle-distance runner who 2 weeks ago in London broke the men's mile world record that had stood for 27 years, a record that had been one of the most resilient in athletics. He runs today at Scotstoun Stadium in Glasgow, his home crowd, in front of the country that produced him. Standing across the track is Cameron Myers, an Australian 20-year-old who has been one of the stories of these games. Young, fast, and publicly described by Olympics.com as a new track sensation who is eyeing an upset. 2 weeks ago, Kerr broke a record that had stood since before Myers was born. Myers is running at the man who broke it, in the man's home country, in a final with gold on the line. Athletics is not the only thing happening today. Boxing culminates with 14 medal rounds, the final sessions of what has been throughout the Games an extraordinarily competitive boxing program. Track cycling and para-track cycling awards 6 titles at the Emirates Arena. Judo awards 5 gold medals. All of this is happening in Glasgow on the first day of August, with the closing ceremony scheduled for tomorrow, August 2nd. The Commonwealth Games does something worth naming as it draws to a close. It is an unusual institution. A competition specifically for the 56 nations and territories that are or were part of the British Empire, a category that includes some of the world's most powerful sporting nations: Australia, England, India, Canada, Alongside some of the world's smallest territories, the Cook Islands sent one athlete to Glasgow. The result is a competition where a swimmer from Nauru can compete in the same pool as an Olympic champion from Jamaica, where a boxer from the Cayman Islands fights in the same brackets as England's national team, where a distance runner from Kenya's 10,000-meter walk final happens across a half-hour from a para-athletics final featuring competitors from New Zealand and South Africa. It is not the Olympics, but it produces a specific kind of sporting encounter, cross-continental, often unexpected, regularly producing results that the world rankings would not have predicted, that the larger games don't always deliver. Josh Kerr running a world record mile attempt in Glasgow, while a 20-year-old Australian tries to beat him in the penultimate session of a games that almost didn't happen, is exactly that kind of moment. It deserves to be watched. Now Iran, because the silence of the past 8 days deserves its own accounting. The US and Iran have, as of the time of writing, not conducted confirmed strikes against each other for approximately 8 days. The last confirmed US strikes were around July 24th, 25th. The last confirmed Iranian retaliation was similar. This is the longest sustained pause in the conflict since the Versailles MOU signing in June, and notably longer than that MOU's ceasefire lasted in practice before it collapsed. Here is what is confirmed about where things stand, synthesized from the most authoritative available sources. The House of Commons Library's July 26 briefing, the British Parliament's own non-partisan research service's most current analysis, confirmed 2 specific, significant shifts in Trump's stated position. First, the president says that recovering Iran's enriched uranium is less urgent than reopening the strait. Second, Iran should be allowed to maintain ballistic missiles in relative proportion to neighboring Gulf states. Both of these are documented retreats from the opening stated justifications for the conflict. Zero enrichment was the stated U.S. objective in 2025 and the early months of the war. No Iranian ballistic missiles was a stated condition. Both have been quietly modified in the direction of accepting Iranian nuclear and missile realities, rather than eliminating them. The U.S.-Saudi nuclear deal, signed on July 22nd, confirmed by the Times of Israel from that day's reporting, created a legal foundation for a decades-long, multi-billion-dollar nuclear partnership with Saudi Arabia. Under a defense secretary who signed it as the U.S. was simultaneously striking Iran to prevent it from having nuclear weapons. The specific tension between these 2 concurrent positions, fighting Iran over nuclear capabilities while signing a nuclear cooperation agreement with its regional rival, has not been addressed in official communications from either government. Russia's satellite targeting assistance to Iran, confirmed by Zelensky's July 25th post on X, corroborated by a U.S. official who told CBS News about it in early March at the war's start, and confirmed in direction by Defense Secretary Hegseth, who told a Senate hearing on July 21st that Russia and China were helping Iran, remains unaddressed by any specific U.S. countermeasure. Trump's response was to say Putin and Xi promised not to sell Iran weapons. Zelensky's accusation concerned intelligence sharing rather than weapons sales. Those remain 2 different things. 18 U.S. service members are confirmed killed in the war. Brent crude sits at approximately $88, down from its $100 peak. Gas prices in the United States remain above $4 per gallon. The IEA's Fatih Birol confirmed this month that a full and unconditional reopening of the Strait of Hormuz will be essential to avoid further deterioration in global energy security. The bombing pause may be a genuine diplomatic window. Deputy foreign ministers of Iran and Oman met about the strait. The 10-day ceasefire proposal sits on the table. Netanyahu met Trump in a session whose outcome neither government disclosed publicly. Or it may be what one U.S. official told Axios. Both sides appear determined to improve their leverage through further strikes before committing to a ceasefire. A pause for diplomatic space and a pause for logistical reloading look identical from the outside. The only thing that distinguishes them is what happens next. The midterm elections are 3 months away. The SCO Heads of State Summit, where Iran is a full member, where Russia and China are also full members, and where Iran's FM has already laid the groundwork for a multilateral coalition against U.S. policy, is scheduled for Bishkek, Kyrgyzstan on August 31st to September 1st. If the pause becomes a deal before then, the diplomatic architecture that Eric Xi was building at the July 24th foreign ministers' meeting matters less. If it doesn't, Iran will walk into that September summit with the active support of Russia and China and 25 bilateral economic agreements freshly signed. That is the timeline the pause is running against. And now the Ebola story, because the contrast between Uganda and the DRC is the most instructive public health story of the month. Uganda declared its Ebola outbreak under control on July 16th, per the European Centre for Disease Prevention and Control's July 23rd confirmed update. The country's last patient was discharged. A 42-day countdown to official outbreak end status began. Uganda had recorded 20 cases and 2 deaths before successfully containing transmission. The Democratic Republic of Congo, where the same Bundibugyo species of the Ebola virus originated, tells a completely different story. As of July 19th, per the United Nations' own confirmed figures from its July 21st audio brief, 2,423 confirmed cases and 967 deaths. 5 provinces affected. Ituri province, in the east, remains the epicenter, accounting for more than 90% of cases. Tierno Balde confirmed, "This outbreak remains ahead of us, and we are still in the phase of catching up." The Sunday Guardian Live's August 1st coverage, confirmed today, featured a piece specifically about Uganda's success, headlined, "Uganda's Ebola Playbook." How a border town turned 20 years of pain into a blueprint for defeating the deadly virus, and what they did differently. That specific framing is the right one, because the difference between Uganda's success and the DRC's struggle is not a mystery to the people studying it. It is specific and documented. Uganda has had repeated Ebola outbreaks since the virus was first identified in the 1970s. Its health infrastructure in affected border regions has built up a specific institutional memory over 2 decades. Community health workers who understand the virus, response protocols that have been tested and refined, and critically, a level of community trust in the healthcare system that means patients don't flee treatment facilities and contact tracing is possible. The country has seen the virus come before. It knows what to do. The DRC's response is operating in the opposite context. The Ituri province, the epicenter of this outbreak, is one of the most conflict-affected regions in the country. Armed militia groups control parts of the territory where cases are spreading. Healthcare workers cannot safely operate in all affected areas. Community trust in healthcare institutions is limited specifically because those institutions have been unable to provide reliable care in conflict conditions for years. Patients who are sick and frightened flee treatment centers. The World Food Program and WHO staff confirmed this in June, when more than 150 patients had escaped facilities since late May, primarily because there was not enough food at the centers treating them. By July 15th, healthcare workers at Bunia General Hospital and Rwampara General Hospital had gone on strike over unpaid wages. These are the hospitals that were treating Ebola patients. Their staff walked out. The contrast is not about willpower or medical capability. Ugandan and Congolese doctors and nurses and community workers are not fundamentally different in their commitment to patient care. The contrast is about infrastructure, funding, conflict, and the specific compounding problem that the DRC's eastern provinces face. That the conditions required for effective outbreak response, safety, access, trust, adequate resourcing of healthcare workers, are exactly the conditions that decades of armed conflict have systematically destroyed. Uganda succeeded because 20 years of pain built a playbook. The DRC is struggling because 20 years of conflict built the opposite, a context in which even getting a healthcare worker paid reliably enough to stay at work during an Ebola outbreak is not something the system can guarantee. The 967 deaths and the 2,423 cases are not a failure of science. The vaccines exist. The protocols work. The failure is of the political economy around outbreak response. The funding shortfalls, the security gaps, the war-damaged infrastructure. The conflict that creates the specific conditions in which a virus that should be containable in days or weeks has been spreading across 5 provinces for months. 3 stories on the first day of August. Glasgow is hosting a Commonwealth Games that almost didn't happen on its biggest medal day, with a world record holder trying to defend his record in front of his home crowd against a 20-year-old who wants to take it from him. The Iran bombing pause has held for 8 days, while the confirmed facts of the conflict, shifted war objectives, Russian satellite intelligence for Iran, and U.S.-Saudi nuclear deal. 18 dead Americans. Oil above $4 at the pump. Remain unchanged and unaddressed in any public statement from either government. And the Ebola virus is killing people at different rates in 2 neighboring African countries, based not on the quality of their doctors, but on the quality of the conditions their doctors are allowed to work in. The mile race starts today. The Iranian decision has no confirmed start time. The DRC's outbreak doesn't wait for either of them. Some days the 3 stories don't have a connecting thread. Today they do. Each one is about whether the systems designed to handle a challenge, competition, conflict, disease, have been adequately built for what they're now facing. The Commonwealth Games survived because Glasgow stepped up. The Iran pause may become a deal, because the bombing depleted munitions enough to make restraint necessary. The DRC's outbreak continues because the health system there was never given what it needed to win against a virus that Uganda, with different resources and different history, managed to contain.